Good morning, I'm Ana Paula. I'm a doctor from USFQ on Ecuador. So today I'm gonna present this article, the artificial intelligence in the diagnosis of low prevalence disease in children. This is a more technological paper because of the conference, not I not talk about many in the medical field. First, we have to know that in children, the principal cause of it's usually that the diseases are genetic instead of in adults that are more commonly acquired. And these diseases are usually difficult to diagnose because we have little literature, limited case report, restrictions at the moment of the diagnosis and management. So with artificial intelligence, we can improve this medical diagnosis because we have more accuracy without many diagnostic tests. We can analyze large volumes of data in less time, and we can detect complex patterns difficult to identify by humans because we can have subtle symptoms in each patient. So it's easier for this tool to analyze it in less time. So this article is has a bibliographic and systematic approach. The general objective is to evaluate the effectiveness of AI in diagnosis of rare disease in children, and we have three specific objectives that are analyze successful cases of AI application, collect statistics of its effectiveness, and identify current trends in pediatrics. So, as in everything, we have some advantages and limitations here, especially in the applications. I'm gonna explain a little of this one, each one. First, let's go to the advantages. So first, we have greater diagnosis precision or in resume anticipation. These only do not improve accuracy, but also optimize the patient care process. As a background, we have that diagnostic errors are responsible for 10% of deaths and 17% of complications in patients. So this can help us in have a more diagnostic precision in less time, so we can help patients before it gets more complicated. For example, there are already many algorithms that can analyze MRI images, so they have proven to improve the accuracy of neurological conditions by 44%. Also, there is a research that have shown that continuous monitoring of vital signs in hospitalization patients can reduce serious adverse effects by 35% and reduce cardiac arrest by 86%. Because I can identify patterns in these patients and can say the doctors based on a probability what could happen to that patient. Also, the optimization of clinical processes, because as I already said, we can analyze large volumes of clinical data and detect patterns that could go unnoticed by doctors. Also, with AI, we can automate repetitive tasks, freeing up times for doctors to focus on the patient care. Also, another advantage is the low cost, because, for example, we can use telemedicine to connect patients with specialists without the need for travel. That is very important, especially in low resource country like it's Ecuador, because we have many rural areas without specialties in medicine and even without doctors. Another advantage is accessibility, because as I already said, you can connect people in remote areas to specialists, even not in the same country, but specialists all around the world. And we have limitations. For example, data quality, because these algorithms that I use depend on the quality and quantity of data they are already trained on. So if you have biased of incomplete data, they can lead to errors that could cost the life of the patient. The lack of transparency, because many of the AI models function as a black box, so meaning that their internal processes are not easily to understand by humans, and this lack of transparency can lead to mistrust among doctors and patients who might be hesitant to fully trust on an AI-based diagnosis. The accessibility, because in low resource countries, there might be areas when you can't really access to AI to help you in the diagnosis. And the other hand, because easy accessibility of patients to information and probably diagnosis can generate discussion between and trust between the patient and family and the medical staff, because the patient will look for by him or herself and can make a trust in the management. And ethics, because for the AI to give you a correct diagnosis, you have to give it a lot of private information. So data privacy and informed consent are important, especially in the case of children that we are talking here. The collection and use of sensitive data about children raises important ethical questions related to informed consent and privacy. Okay, so we already have a lot of AI tools that helps us in diagnosing in children, but I just write it the two most important. PheNet. PheNet is an algorithm developed by the UCLA researchers and has been able to diagnose the diseases such as common variable immunodeficiency up to a year earlier than the traditional methods. It uses records to compare phenotypic patterns, and in this study, it was shown that it could have diagnosed 64% patients 1 or more years before the definitive diagnosis. So 1 or more years before means a better prognosis to the patient. The other one is Face2Gene. This uses facial recognition to identify rare diseases with 91% of accuracy, and this reduced the time and cost of traditional diagnosis. With this tool, we can have personalized medicine, because by analyzing large amounts of clinical and genetic data, AI enables personalized treatments, improving response to specific therapies in children with cancer and other serious diseases. So, as a conclusion, artificial intelligence is redefining the landscape of diagnosis and treatment in patients, especially in pediatrics, because, as I said, pediatrics has the most prevalence with genetic and rare conditions compared to adults, offering valuable tools to address both common and low prevalence conditions. As these technologies continue to evolve, it's critical to continue researching their effective and ethical application. And the future work, as I said, is address the ethical concerns through ongoing research and appropriate clinical development. It's necessary to establish rigorous standards to ensure that the data used is representative and free of bias. And it's essential to get a greater collaboration between technology developers, medical professions, policymakers, to ensure that these AI-based solutions are accessible and equitable. That is all the presentation. In case you have